Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights. As federal government reopens schools for exiting students' WAEC examination, the Nigerian Medical Association insists on full compliance to the recommended guidelines to avert potential spikes. Frontline workers in Ekiti State cry out over unpaid COVID-19 allowances. And amid the rise in coronavirus cases, countries in Europe adopt fresh measures to reduce the virus spread. Nigeria has recorded 41,180 confirmed cases of COVID-19 after the announcement of 648 new infections and 2 deaths in the last 24 hours. Till date, 18,203 cases have been discharged and 860 deaths have been recorded in 36 states and the Federal Capital Territory. The 648 new cases are reported from 21 states, including the FCT Lagos with 180, Plateau 148, the FCT 44, 42 in Ondo State, 38 in Kwara, 32 in Rivers, 29 in Oyo, 21 in Kaduna. Osun recorded 20, 17 in Edo, 17 again in Ogun State, 11 in Ekiti, 9 in Kano, 9 as well in Benue, Delta and Abia states, while 7 cases were recorded in Niger, 3 in Gombe, and 1 each in Borno, Bauchi and Imo states. So far, 9 states and the FCT have recorded over 1,000 confirmed cases, while only 6 states have currently cases on admission, over 500. You have Lagos, the FCT, Oyo, Edo, Ondo, Plateau and Kwara State. These are over 500 cases that are receiving treatment at the centers. Now, doctors in the employment of the Ekiti State government have been making certain demands for their welfare as the strike enters another week. These doctors comprise those in the state's general hospitals, the specialist hospitals and the primary health care facilities, among others. Here's our correspondent, Babajide Agbeyo, with more.
While the governor of Ekiti State, Dr. Kaode Fayemi, has gone on isolation for COVID-19 treatment, the State Attorney General, Mr. Wale Fapunda, has also announced that he tested positive for the virus. The governor had advised members of his cabinet and his close aides to go for testing to ascertain their status at this time. At the medical front, doctors in the employ of the Ekiti State government have been flogging certain demands for which they have been on strike for over 2 weeks now. These doctors comprise those in the state general hospitals, state specialist hospitals, and primary healthcare facilities, among others. They complain of unpaid COVID-19 allowances, hazard allowances, rural posting allowances, and delayed promotion, among other grievances which they have listed.
Averagely, the minimum amount of doctors required to manage all these 22 hospitals and state specialist hospitals, they should be around 266 or 256. Now we are operating with just 71. And even the 71 that are doing the job, they are being paid far less than what they should be paid.
Nobody is disagreeing that paying people what they think they should be paid is wrong. The only thing we are discussing is that it's not the best time. This time that COVID-19 is going on, the states are struggling to give PPE, to pay for all the things they have to pay for. The money is not just there.
It is definitely expedient for these key players to, at this time, reach a compromise, as any decimation of hands in the health sector will not be healthy for the system at the moment. Babajide Agbeyo for COVID-19 update.
The Gombe state government has revised the 2020 budget from 130.8 billion naira to 107 billion naira. The revised budget, which was passed by the State Assembly, was signed into law by the state governor, Inuwa Yahaya, who says the reduction of the budget size was due to the prevailing economic challenges as a result of the COVID-19 pandemic. He said the sum of 500 million naira is provided for the task force to boost the health sector, and equally 500 million intervention for activities including the establishment of isolation centres, renovating, upgrading and equipping healthcare facilities, as well as the procurement and provision of medical supplies.
The earlier budget, Appropriation Act, statutory allocation was 42 billion. Now it has been revised down to 29 billion. It's a variance of 13 billion. Value added tax was 15 billion. Now it has been revised to 11.5 billion. That's creating a variance of 3.5 billion. And then internally generated revenue was 11.265 billion. Now it has been adjusted to 9.9 billion. It's a variance of 1.347 billion. Having found ourselves with the COVID-19 pandemic to grapple with, and equally having the need to reprioritize and pay attention to the urgent needs, we have to make all those adjustments. And so far, we've made adequate provisions on COVID-19 by way of providing 500 million naira for the task force, the Ministry of Health. That is to boost the health sector. And equally, we provided 500 million intervention in the Ministry of Health for activities including the creation of isolation centers and the renovation and upgrading and equipping and procurement of medical supplies.
A similar amendment was done, this time with the Cross River State government, as it forwarded a budget review and amendment proposal of about 147 billion naira to the Cross River State House of Assembly to streamline the state's estimates of revenue and expenditures in line with the current economic realities. Approximately 16% of the amended budget expenditure earmarked for COVID-19 response programs for relief, restructuring and recovery.
This budget has been submitted to the House of Assembly for its consideration, its review, and possible resolution. The budget, as submitted, has a revised figure of 140,130,166,966 naira. The COVID-19 response budget items are marked at 16.3% of the amended budget. We expressly identified and stated the financing sources to fully finance the budget deficit without accumulation of new domestic arrears. Those were the four things that we expressly did under this amended budget exercise. The second initiative, in order to cushion the effects of the pandemic, especially the economic issues, the Cross River State government formulated tax breaks and reliefs to businesses and individuals operating and resident in Cross River State. This was done to cushion the negative impact of the pandemic. While giving these breaks, the service will be ensuring that it strengthens the collection modalities to eliminate leakages, as well as developing its database and strengthening the possible revenues from the land and associated revenue streams.
Now, the Minister of State for Education yesterday at the PTO briefing during the question and answer session clarified on the schools reopening as only schools which are examination centres for the West African Examination Council in respect of exiting classes. According to him, these centres are to report back on the 29th of July as to the state of preparedness for the safe reopening of the schools.
The schools that will be reopening are schools that are centers for these exams, and only in respect of the exiting classes. Primary schools and all other classes are excluded from this decision-making process. We arrived at this decision, like I explained, having met with all the stakeholders. Part of what they will update us with on Friday, on 29th, our cutoff date is 29th, which is 3 days time, in 2 days time, will be for them to report back as to their state of preparedness on the 29th. The state of preparedness of each of these centers will inform how they open. I'm in discussions with my brother, the Minister of Environment, and we are also waiting at the Ministry of Education. Wherever we see gaps in their state of preparedness, we will address and help get in there. If it is not possible, then we will not be able to use them. But all the state governors and state commissioners of education and all the other stakeholders, Association of Private School Owners, have all given us their commitment that they will try to resolve this, provide for the teachers. WAEC will also provide for their invigilators and make sure that this conduct is seamless.
For more on the safe reopening of schools, the president of the Nigerian Medical Association, Professor Innocent Uja, joins us on the program from our Abuja studios. Thank you for joining us. I'd like to begin by what everyone is insisting on, and that is the safe reopening of schools. This is for the examinations. Are you optimistic as to the preparedness of all the stakeholders involved?
Well, thank you very much and good afternoon. The Nigerian Medical Association is not convinced that the federal and state governments are ready for the reopening of schools for children. The proprietors, the teachers, in our opinion, I do not see anything on ground to suggest that our children will not be at risk of contracting the disease. If, however, they say they are, then, of course, as you all know, they have to take responsibility for any child that, because of the reopening of the school, they will have to take responsibility for them. We know, we appreciate the challenges that are associated, i.e. the private, the various schools, the school fees are not being paid, so they don't have money, the teachers are not being paid, the students will need to get to school to write examination. That is true. However, if only we are ready, when we say we are ready, when we say we should be ready, is that the compliance, if you look at the general population, the compliance level is very, very poor. Social distancing is completely a failure. Use of face mask, I can see, looking at people in marketplaces and the rest, you find that very, very few people use face mask. And then, of course, hand washing and sanitizers, probably that may be a little bit better.
Professor Uja.
But the reality on ground is that we are not ready for the schools to reopen. But we can be ready. You see, we are very quick to transmit what happens in other climes without looking at the processes. You all recall that when South Africa started, they reopened schools, and shortly after that, they closed it because the children were getting infected. So have we learned any lesson from South Africa and other countries that reopened and had to close down? So the pressures are coming from parents, they are coming from teachers, they are coming from proprietors. That is for the private schools. What about the governments, the public schools? How ready are we? Now that the pressures are coming from parents because of justifiably their desire for their children to write the school start exams. Now, if any child is infected, the first group of people that will castigate the governments are those people, the parents. So they should know that it takes two to make a pair. They are putting pressure on government, and it's because of the fact that the government yielded to their pressure that they are reopening the school. It's not, I don't think that we are sufficiently ready to
Professor
resume,
Ujah, I want
to reopen the schools for our children.
Yes, you've said a lot of things, but I also want you to consider the compliance which you mentioned. You're saying a lot of people are not complying, but does that mean that if we're told that the virus is going to be with us for quite a long time, do we keep waiting until, we totally do not have it? And you also mentioned some processes, what must be available for safe reopening. And let's not also forget that this is with regards to exiting students. So it's assumed that there'll be perhaps a lot more spaces, and that decision will be made July the 29th. So we still have a day and a number of hours. But I'll come back to get your thoughts on the processes that you think should happen when we return. Welcome back. We've been talking with the president of the Nigerian Medical Association, Professor Innocent Ujah, who is in our Abuja studio. So, Professor, just wrapping up on perhaps some of the solutions you think with regards to the safe reopening of schools. Would you say we should give it more time? And let's not forget the exiting students who are to write their exams.
Well, what we are saying is that we need to be prepared, and it's part of the emergency preparedness and response. If we're saying that the students should reopen, what is it on ground that will ensure that they are safe when they go to school? As you know, many of Nigerians do not even believe that COVID exists. How would they prepare themselves from the home to school? It's not so much about school alone, it's even about home. At the moment, there are so very many Nigerians who have COVID and are treating themselves in various ways at home, in prayer houses, among babalawos, before some of them are, of course, in the isolation centers. So we do not have complete information as to the level of preparedness of the government, the private sector, the schools, the proprietors, the teachers, and even then, the 2 weeks they are given for the students before they write their exams, are we convinced in our own mind that those 2 weeks are justified? What result will they expect? Obviously, it certainly will not be the best of results. Apart from the fear that some of them may contract the disease, the level of preparedness, in my opinion, is not justified.
We'd like to thank you.
Write examination within 2 weeks. If you know, these are young children.
Indeed, a lot of things to consider based on all the stakeholders involved. We'd like to thank you so much. The president of the NMA, Professor Innocent Ujah, thank you for joining us on the program.
Thank you very much. I'm delighted. And the channel is doing its best in informing and educating the public.
Thank you. We'll continue to do that and do much more. Now, just the fact of someone wondering if he or she is positive for COVID-19 is like having a stigma and something that is threatening his life. And that affects, of course, his behavior. Not knowing or wondering if you'd get it is another thing. How can we protect ourselves from panic and, of course, protect others around us on the state of the pandemic and its effect on mental health? We have a professor of Harvard School of Public Health, Professor Nkechi Onyenehu. She joins us from Boston, Massachusetts. Thank you, Professor, for joining us on the program. I want to start with the infection spread in the U.S. Is the country making any headway in cutting down transmission?
Thank you for having me on the program. I'm sure you do know that more states are recording more cases as the days go by. It's the numbers are climbing in spite of all the efforts made to bring the numbers down, the cases down. It is not happening, and there's no end in sight.
So talking about people,
that if we continue,
okay. I wanted to add, talking about people's behavior, and their response to this. We have a lot of people who are perhaps tired of staying home, and in as much as we see many people wearing the face mask, what is the behavior behind perhaps people who feel that this pandemic is not real, people who might have gotten it and perhaps have stigma?
I tell you something, man is a social being. We are born to socialize, to mix with one another. It's difficult for people to stay indoors. it's difficult for people to be socially distant. Physical distancing, it's possible, but social distancing is even worse, almost impossible for the human mind. So people are already COVID-19 weary. They are tired of staying indoors. They are tired of, doing everything they ought to do, in spite of the fact that this is what needs to be done. I can't say I blame them, but because we have a pandemic to worry about, because we have lives to save, ours and those of people that we love, there is need for us to continue to abide by all the protocols that have been given. So at the moment, people are no longer able to stay indoors. When you say stay home, it's becoming harder by the day for people to do so.
How would you assess the impact of the pandemic, first on frontline workers who receive people with COVID and who see COVID patients die as well?
Everyone experiences this pandemic differently. For those in the front line, for people at home, everyone feels the stress of the pandemic. But then again, most people have different backgrounds, different social support systems, different financial situations, different health and emotional backgrounds. Therefore, each person will experience it differently. For those in the front line, of course, it's hard for them. It's really hard to see people die so very often. It's hard to be so very helpless in the face of the pandemic. So many of them will suffer a lot of emotional troubles. Mental health problem may be on the rise very soon if care is not taken. Because these people, their experience of the pandemic is quite different from yourself and myself. So for them, in the next few days ahead, we may be looking for mental health and support for them.
So perhaps in a few seconds, how would you say people should go about living this new normal?
We already know it's a new normal. We must live with it the way it is. It's almost, some kind of madness to say that this is how I want life to be. We have to do the reality check, which means live life the way it is, not the way you would wish it to be. If the pandemic has come to be with us, then all we need to do is respect the protocols, respect whatever you need to do to keep yourself and your family safe.
We'd like to thank you so much, Professor of Harvard School of Public Health, Professor Nkechi Onyedeho. Thank you for joining us on the program.
Thank you very much.
Now, spurred by fears of resurgent coronavirus infections, several European countries are adopting fresh measures to combat transmissions. While the outbreak remains under control in many parts of Spain, certain areas have seen a huge spike in cases. As a result, neighboring countries are warning citizens against travel to the country.
Amid fears of a spike in coronavirus cases in Europe, Belgium is tightening restrictions but avoiding another lockdown. From Wednesday, residents will be allowed to see a maximum of 5 people outside of their families. The number of people allowed to gather in public is also reduced to 100 indoors and 200 outdoors. Meanwhile, in Germany, authorities say the rapid rise in coronavirus numbers is very worrying and have warned citizens against any unnecessary travel to 3 regions in Spain. The Health Ministry says coronavirus tests will be made compulsory for anyone traveling into the country from high-risk areas. They also urge citizens to keep their distance and wear face masks. Neighbouring France has ordered night curfews for beaches in the west of the country after a cluster of cases emerged in a resort last week. And Spain's Prime Minister, Pedro Sanchez, says the UK's 14-day isolation on anyone arriving from Spain is unjust and tourists would be safer from coronavirus in most Spanish regions than in the UK.
For more updates, take a look at our website, channelstv.com. It has the latest updates on the pandemic and several other stories as well. You can take a closer look at stories coming in from Africa, Nigeria, and the rest of the world. You can see that top story of Peru saying over 900 girls and women are feared dead since the pandemic began. That's the program. Thank you for watching. I'm Millicent Nwaka. Stay safe.